afternoon. Good morning. I'm Steve Geller. I'm the mayor of Broward County. Thank you for attending today's press conference. We have good news and bad news. As I've been saying, Broward County, we currently have approximately 57% of our eligible population in Broward County has been vaccinated. That is a somewhat misleading number because that includes the people that are 12 to 16, and there's only 4% vaccination rate in that age cohort. So I am estimating that we are somewhere approximately 59 or 60% in our 18-year-old plus population. The bad news, however, is the number of people getting vaccine continues to decline. Over the last 13 days, our average has been somewhere approximately 4,500 people per day. This is down from 30 or 35,000 people a day at our peak. As you can see, the numbers are just not very good, and that's including the 4,500 is including the fact that we have recently opened for 16 to 18, that was several weeks ago, and just recently 12 to 16. On Thursday, May 13th, the CDC announced that they were issuing new guidance allowing vaccinated people to not have to wear masks indoors or outdoors, with a few caveats such as being in extremely crowded areas, being around people with immunocompromised systems, etc. On this Monday, 2 days ago, Broward County issued a directive saying that we would no longer require masks in county buildings. We did this on a Monday, effective the following day, yesterday, so that anybody that was working that had particular health concerns about coming into contact with people that were not wearing masks would have the opportunity to take appropriate steps. CDC, as I said, has authorized vaccine for people 12 and older. The county commission meetings are no longer requiring fully vaccinated attendees to wear masks. And I say all of these are for fully vaccinated attendees, but of course HIPAA prevents us from asking people if they're fully vaccinated. So we are asking our residents, visitors, and businesses to actually comply with the honor system that is in place and to use common sense and social distancing. Broward County had previously voted to reopen our commission meetings on a limited basis. As you can see, a lot of the seats are marked off to ensure that there's social distancing, but we still have room for people to attend. Because of the limited space, they're permitted to come in and speak on the item or items that they are speaking on, after which they are asked to leave the chambers so that we can still adhere to social distancing. As of yesterday's numbers, the Broward County positivity rate is 3.1%. The numbers are lower today than they were at my last press conference. They have continued to improve. Maybe a month ago, the numbers were between 6 and 7%, and as I said, we're currently at 3.1. When you have roughly 60% of the adult population vaccinated, you would expect the numbers to continue to improve. However, I have sensed almost a sense of giddiness that the COVID crisis is now completely over. It is not completely over. It has been substantially improving, and if we continue to use common sense precautions, it is our hope that we can beat this. But remember, in order to beat COVID, we need to reach herd immunity. Herd immunity is somewhere around, I've seen numbers anywhere from 65 to 85%, so I'm assuming it's somewhere around 70 or 75%, 70 to 80%. And remember, the number I've been giving is for adults, which is 60%. If you look at our total vaccination rate in Broward, and that total is from infants to 85 plus, we're only around 47% vaccinated. And by the way, Broward's vaccination numbers are better substantially better than the statewide averages. I think we may be the highest in the state. If not, we're certainly one of the 2 or 3 highest in the state. I haven't examined every other county's numbers. It's important to recognize when we're talking about our 3.1% rate in Broward County, which, as I said, is better than the state. That's using the way the state of Florida calculates its numbers, which is a way that no other state calculates. When Florida calculates its numbers, if you test negative 5 times in a row, they count all 5 negatives. If you test positive 5 times in a row, they only count the first positive. Other states don't calculate that way. The New York Times has calculated that our numbers are roughly twice as high as the official statewide announced numbers. Additionally, to confirm those numbers, both CDC and Johns Hopkins recommend that you look at 2 sets of numbers. One is the overall vaccination rate. The second is the number of new COVID cases diagnosed per 100,000 of population. CDC said that we should not consider reopening, Johns Hopkins said that we should not consider reopening until our number was between 10%, was lower than 10%, and we should not stop wearing masks until our numbers were somewhere around 2 or 3%. As the most recent number that I had seen was our numbers were 11.8%. I'm sorry, not percent, 11.8 new cases per 100,000 of population. So again, our numbers are much, much better than they used to be, but we're still not out of the woods yet. I am asking people to continue to be careful, and I am begging everybody to get vaccinated. I believe that we need to get everybody in Broward vaccinated. We have the I Did It campaign. In Spanish, it's Yo lo hice. It is extremely important that everybody get vaccinated. The I Did It campaign is running ads in English, Spanish, Creole, and Portuguese, trying to get everybody vaccinated. We're working with our community leaders, our faith-based leaders, and I believe that our local municipal elected officials may be in the best position to work. We have seen in Broward County, some of our southern Broward counties have the lowest zip code, some of the lowest cities. The zip codes in South Broward and in some areas of West Broward show an alarming discrepancy in the percentage of people vaccinated. We have seen particular hesitancy in the Caribbean English-speaking and Caribbean French-speaking community, Caribbean American communities. And again, it does not matter what your age, what your ethnicity, what your religion, what your national origin is. I am again urging everybody to please protect yourself, your friends, your family, your community, and your country. Do the patriotic thing and get vaccinated. COVID is not over. It is contained. It is improving. I've just read that the India variant is now in the United States. Again, we have the Brazilian variant. We have several other variants, and we have to reach herd immunity. We have to stop the spread before some of these new variants or other new variants take hold that might defeat the vaccinations. Right now, as far as we know, our vaccinations are still effective against all of the variants, but we're not 100% certain on that. Testing is still continuing. So again, I'm begging everybody to please get vaccinated. Let me discuss the rental assistance program. The program is being marketed on social media, radio ads, door-to-door, email sent to nonprofits, etc. We have not had as many people as we would like have applied for that. As of May 17th, we had 5,529 applications. Again, this new program is for people that have a certain income cap, but there are other programs, older programs, that don't have the same income limitation. So if you are having problems paying your rent, and you will have to prove that it is because your income was affected by COVID, please contact broward.org/rent assistance. Let me discuss the cruise industry. As I believe everybody here knows, the cruise industry is extremely important to Broward County and to South Florida in general. I will claim credit for getting the cruise industry going again, even though I probably had nothing to do with that. But, sometimes we're politicians and we can't resist. I had previously sent a letter to the Florida congressional delegation and the CDC asking them to issue guidelines permitting the cruise lines to reopen safely. About a week after that email, the CDC did issue guidance to the cruise industry, allowing them to operate if 98% of the crew and 95% of the passengers were vaccinated, provided that the crew and passengers are wearing masks. After that guideline was announced, Norwegian Cruise Lines asked that they be allowed to have their passengers go maskless, providing that 100% of their passengers and crew were vaccinated. To me, that seemed like a very reasonable request, and I wrote to the CDC requesting that they consider that, and several days after I sent that letter, they said that they would do that. Now, really, I think I just happened to time my letters in a timely fashion, but I'll take credit anyhow. Just kidding. Our problem right now is we seem to be at a deadlock because the CDC has said that they will require either 98% crew, 95% passengers to be vaccinated with mask wearing, or as an alternative to that, 100% of passengers and crews to be vaccinated without masks. Governor DeSantis has said that he will not permit the cruise lines to require proof of vaccination. So we are currently in a standoff. I have no prediction how that standoff will be resolved. However, I believe that it is important to the state that we permit the cruise lines to continue to sail or to start to sail again. I do not want, NCL has threatened to leave if they can't sail. Governor DeSantis has indicated, well, they're a small cruise line, so let them leave. I prefer that there are three major national cruise lines. NCL is one of them, although it is the smallest of the three. And I certainly would like them to stay in Florida, and I hope that there is a way of resolving this so that the cruise lines can start sailing out of South Florida again. Let me comment, as you may have seen at the commission while we're discussing cruise lines, that as was announced at our commission meeting yesterday, Disney Cruise Lines is currently planning on establishing Broward County as their South Florida base, and we're very pleased to have that occur in Broward County. We know that Disney people go on Disney Cruise Lines because they are generally more family cruises, tend to spend more time in a county than people that just fly in, and we are pleased that they will be taking advantage of Broward County's numerous family-friendly activities. Also discussed at the county commission yesterday were towing ordinances. There was discussion of a ballot referendum to establish a county-wide elected weak mayor. As you know, although I am currently mayor of Broward, I am elected for a one-year term by the 9 commissioners. This would change it to a county-wide elected mayor, although it would have the same powers that I currently have as mayor. That would, in order to get on the ballot, it would need 6 out of 9 votes. And yesterday there appeared to be at least 4 no votes, but we'll see what happens on that. Another issue which came up was an allocation of proceeds from lapsed expiring CRA, community redevelopment agencies, and I had put something on which passed as a direction to say that that cities that adopt my transit-oriented development program with affordable housing component would get preference in expiring CRA monies. I do want to let everybody know about this program because I think it's important. Broward County needs to build additional housing units. We have South Florida has one of the biggest affordable housing crises in the nation. Our housing is not the most expensive in the nation, but when you look at housing cost as a percentage of income, because our housing is pretty expensive and our average income is comparatively low, it means our unaffordability level in South Florida and Orlando are the 2 worst in the nation. And so we need to get more government finance assisted affordable housing, but we also just need to build more units because the law of supply and demand will help in that area. Normally, you can just sprawl. If you're in Phoenix, you just build further out into the desert. But in Broward County, if you go any further north, you hit Boca, or you hit Palm Beach County. If you go any further south, you hit Dade County. Go further east or west, you get your feet wet. So if we're going to add units, there's only one direction left, and that's up. So the program that I've authored would permit only on the major transit thoroughfares, the major roadways. It's transit-oriented development. We are giving local governments the option. We are not requiring them to do anything, but we are giving them the option of permitting residential development on existing commercial properties. Again, not requiring anything. But if they do this, they have to build a affordable housing component into this or buy out. It has been widely praised. The development community thinks it's a great idea. The affordable housing people like it. And we have previously, since it's all transit-oriented development, advised that cities that adopt this as a permitted use, not as a conditional use, meaning that they would have to approve it. If a city does that, they will get additional points when the county's giving out its transit dollars, and yesterday we decided that they would get additional points when we're divvying up expiring CRA dollars. I also wanted to mention one last issue before I take questions, which is the Broward has, like all of South Florida does, has a lot of water issues, but there's one issue that I really want to bring to everyone's attention, which is the Central and South Florida flood restudy. Sounds like a very dry arcane area. It's not dry at all. The problem is it's actually very, very wet. Broward County, western Broward County, was carved out of the Everglades, and we are in a subtropical atmosphere where we get a lot of rain. What happens in western Broward is all of that rainfall drains through the canal systems to the ocean, but they're gravity fed, so it works fine as long as the inland area is higher than the ocean. With sea level rise, we're starting to have problems that that's not going to be the case. And we have been working with the Army Corps of Engineers. We've been working with our congressional delegation to get a restudy to deal with how South Florida from, Dade, Broward, Palm Beach, I believe as far north as Martin and St. Lucie counties, are going to be able to drain, because unfortunately the canals right now, based on sea level rise, they're within a few inches of overtopping the salinity control areas. The Army Corps has advised that the best case scenario is that they can have new salinity control structures in place in 10 or 11 years, but we're expecting it's probably going to be around 15 years. If sea level rise continues at its current rate, prior to 15 years, the sea level will have risen another 3 or 4 inches, which means that it will overtop the salinity control. And if you're relying on gravity to control your flooding in western Broward, and you can't drain any longer because the area you're draining to, the ocean, is higher than the inland area, it will be a huge problem. We may be unable to get proper drainage in western Broward, western Dade, western Palm Beach counties, and this would result in massive flooding in western Broward. So people need to wake up to this very, very real possibility. Contact your congressional delegation. I must compliment them. They've been doing everything they can to help thus far, but it really is a crucial issue. And the problem is it's one that probably won't really affect us for 10 or 15 years. I'll be out of office by then, but we can't wait because it's going to take 10 or 15 years to make the fix. So if we don't start the study now, get it funded, then it's going to be too late to get the drainage done. So at this point in time, I'll be happy to answer any questions. As you'll note, for those of you that have been coming to the press conferences, traditionally they've been almost exclusively COVID. That's just not going to be the case any longer. I'm to let you know what's happening in Broward and what's happening with COVID. But, hopefully we're continuing to improve the COVID numbers and they will no longer be the all-encompassing issue that they have been in the past. Are there any questions?
Hello, sir. Marissa Bagg with Channel 6. My first question has to do with the mask changes, the CDC recommendations that have changed in the last several days, and the fact that a lot of entities are now focused and relying on the honor system when it comes to who wears a mask and who doesn't. Can you just talk about what you think about that and if you think that people will actually follow those recommendations, whether they're vaccinated or not?
Do I think that people that are not vaccinated will go out without masks? Yes, I do, unfortunately. We have seen, for reasons that I do not fully understand, masks and vaccinations have become a political issue. And the anti-maskers and the anti-vaxxers have been largely the same people. And if you are proud that you have not, succumbed to the man, or whatever the phrase would be, and you're proud that you were willing to get fined for not wearing a mask, yeah, I think that these people are just going to say, I'm not going to wear a mask, and you can't ask me if I'm vaccinated, because under HIPAA, government at least cannot ask people if they're wearing masks. I don't know how it affects private individuals, but we are in an honor system. Would I have preferred that the counties continue to have some ability to enforce in certain areas? Absolutely. Do we have that ability? We do not. Governor DeSantis has not only taken away from us completely our ability to require masks, to do fines or anything, he has pardoned, given executive clemency to people that completely flouted all of our emergency orders. Do I like that? Not at all, not one bit. We are a government of laws. The governor has issued his orders. Broward County will follow those orders. Do I like it? No, I don't. Did I answer your question?
Yes, thank you. I have another question.
Go ahead.
It has to do with the vaccines, and as you mentioned, the severe lowered demand in them and lowered interest in them.
Yes, ma'am.
And I just want to double check a number. Did you say the average right now of people getting vaccinated in Broward County is between 1,000 and 2,000 people?
I did not. Our daily average right now is approximately 4,500.
4,500. Okay, I must have
Yes.
misheard that. And that's at all vaccinated sites that the county has any involvement in Broward?
The numbers that I have I got them this morning from Dr. Paula Thatchy, who is the director of the Florida Department of Health in Broward County. It is traditionally the numbers that I receive are from all sources in Broward County. That would include the ones run by the county health department. It would include Publix, CVS, Walgreens. It includes all vaccines for all ages, the hospital districts from all sources. And again, that number is 15% maybe of what we were at our peak. And the numbers have slowed down dramatically. They've increased a little because this is the first week that we've been vaccinating 12 to 16-year-olds. But I am very worried that that means that the number of adults being vaccinated has gone down quite dramatically. If I'm going to guess, it's probably only, and this may be the number, 1,000 or 2,000 adults being vaccinated. The total number is all I have, which is 4,500. But I'm guessing if that's 4,500, that probably no more than 1,000 to 2,000 adults are being vaccinated.
And as far as the cruise industry is concerned, I also thought I heard you say on the call that, Disney is coming here to Port Everglades. More than likely, it's something you all are considering, but that they're flat out leaving Port Miami.
That's my understanding, that they are going to have one headquarters in South Florida, and that will be in Broward County.
So they would no longer sail from Port Miami?
That is my understanding, yes.
Okay.
That was what, I put this, when I say that's my understanding, that's what was explained to us yesterday.
Thank you.
Thank you. Are there any additional questions?
Mayor, I also noticed you're not wearing a mask for the first time, so that's got to be a positive development today.
I have my mask here. I was wearing it in my office. You'll note that everyone around me is masked, and he's closest to me, and he's 20 feet away. I have been wearing a mask, even though I am double vaccinated, Pfizer, and have been for, 6 or 8 weeks now. But I have worn a mask anyhow as a symbol that, government officials are not above mask wearing, that everybody should be wearing masks. I continue to wear my mask outdoors when I'm going shopping, wherever I'm out. I continue to wear my mask because I think it important that government officials send that message.
And just to clarify, mask wearing is recommended, not required in this building any longer, correct?
As of 2 days ago, Monday, mask wearing is recommended, but on Monday we announced that as of yesterday, it would be recommended but not required. That is correct. Nonetheless, again, all of my office staff and I think all of the county staff that I see are still wearing it. Are there any additional questions? I got all day. Any additional questions? Going? Yes, sir.
Mayor, I'm sorry. Are airports included in buildings that no longer require masks, or is
No, sir.
grounds?
They are required. Remember, I have to obey governor's order because the state is superior to the county. The state must obey federal orders. And the federal government has said that on all areas of interstate travel, which includes buses, includes trains, it includes planes, includes ships, that masks are still required. Are there any additional? Yes, sir.
Just one last one. In terms of economics, do you have any feedback from restaurant owners and private business owners in terms of how they're faring right now?
No, sir. We don't have any actual measurements. I have spoken with a number of business owners, specifically in the hotel, restaurant, and bar community. They are absolutely thrilled with this, but it's just too new for them to have reliable numbers. I'm sure we'll be getting them shortly. I can tell you that they are very pleased with this. I would have certainly, under the criteria that I recommended to the county commission, which were well-researched, run by CDC, run by Johns Hopkins, run by the head epidemiologist of Florida, run by the Health and Human Services of the federal government, we would have been open anyhow using our current numbers. So the only concern that we sometimes have is in bars where there's not sufficient separation and where a lot of the people at a lot of the bars tend to be younger people congregating very closely without wearing masks. And if I could regulate that in some fashion, I believe the county would continue to regulate that. But since we can't, we won't. Are there any additional questions? Anything? Going? Gone. Thank you for being here today.